So it's 2 o'clock, and I think I will start the proceedings for today. Uh, I'm Dr. Mehta. I'm the Director of Lab Services at Rajiv Gandhi Cancer Institute and Research Center. And on behalf of the management and myself, a very good afternoon to you and warm greetings to all of you. And I would also like to welcome everyone present here on this public education series on cancer risk, cancer causality, and cancer prevention. And this lecture series is a part of our 25th anniversary. And you will all agree, talking about anniversaries, that anniversaries are meant to recollect the past and cherish the fond memories and share them with friends and well wishers. And thank you all for coming us, supporting us here, and being part of this whole program. Thank you for being our supporters and well wishers. Now, RGCIRC is a brainchild of a band of good Samaritans who were invested with extraordinary core human values, and they thought it is their duty to lessen the sufferings of the cancer patient. And they raised this hospital to provide affordable and comprehensive cancer care facility, which is also quality managed. And they did so despite several impediments and limited resources. And from a humble start 25 years back, this cancer hospital, now Rajiv Gandhi Cancer Institute and Research Center, is one of the biggest cancer care center in North India with the most advanced cancer management tools and a highly professional team. And all this has been assembled under one roof. So one doesn't have to actually access any service from outside. And during this 25 years of its existence, it has treated more than 300,000 patients. Uh, and it is their faith, their blessings, and their good wishes that this center has grown to this extent and is now celebrating its 25th anniversary. And as a small token of our gratitude and to honor your faith and to honor your belonging with us, this lecture series has been organized to answer their often repeated queries on risk, on causativeness, and prevention of cancers. I hope this effort will lead to better understanding of the origin of cancer and the ways and means to prevent it, and how by affecting small lifestyle changes and environmental modifications, we can reduce the incidence of cancer. Hopefully, by this and similar efforts in many hospitals and worldwide, we will be able to push the cancer back and at some point of a time in near future make it a history. And with this, I thank you once again for being here as a part of us and to support our endeavors. And I, with this, hand over the proceedings to Dr. Kundan Shufal, who will conduct the first of the maiden lecture of this series today, which will be delivered by Dr. Gauri Kapoor. So, Dr. Kundan, please take over.
Thank you, sir. Thank you for your nice introduction. So, good afternoon, all the participants here, and I welcome you all to this educational session. So, as Dr. Mehta has very well elucidated, that 25 years ago, we embarked on a journey with a vision in our mind to provide the best oncological care to those who need it. Rajiv Gandhi Cancer Institute and Research Center is the fulfillment of that vision. And we felt that the best way to celebrate this long and wonderful journey would be something dedicated to cancer awareness and education. In this effort, we have organized a series of lectures, and today's session is on apt and relevant topic to offer a better understanding of what cancer is and how environment plays a role in its development. I would like to invite Dr. Gauri Kapoor for this lecture. Dr. Gauri Kapoor is a leading pediatric oncologist of national and international stature. She carries an experience of more than 3 decades in pediatric oncology, medical oncology. She has also worked with Tata Memorial Hospital, Mumbai, St. Jude Children's Research Hospital, Memphis, USA, and she is a recipient of Heinz Fellowship, Royal College of Pediatrics and Child Health, London. Currently, she is a director and head of Department of Pediatric Oncology, Rajiv Gandhi Cancer Institute and Research Center, with an additional responsibilities of medical director of our Niti Bagh branch. She joined RGCIRC in May 1997 and developed the Department of Pediatric Oncology to its current premier status. Her interest in academics and research is well known, and she has more than 75 publications in peer-reviewed journals. Her areas of interest includes pediatric leukemias, molecular oncology, stem cell transplant, survivorship, and awareness programs for childhood cancer for general public as well as practitioners. So with this, I would like to welcome Dr. Gauri Kapoor. Thank you.
Thank you, Dr. Kundan, Dr. Anurag Mehta. I hope I'm audible.
Yeah, ma'am, you are audible. You are audible.
Thank you very much. And ladies and gentlemen, good afternoon. देवियों और सज्जनों, आप सबको नमस्कार and thank you for joining our awareness public lecture series जो हमारे 25वें सालगिरह पे हमने शुरू किया है as a part of our social and community drive. I hope that you will enjoy some of the details in this lecture and I also hope कि आप लोग हमें feedback देंगे chat box के जरिए ताकि आपकी जो भी queries होंगी वो हम इस talk के बाद डिस्कस कर सकते हैं और आपको clarification दे सकते हैं. इन्हीं शब्दों से हमारा आज का जो टॉपिक है वो पर्यावरण, प्रदूषण एवं कैंसर के ऊपर है. आवर एनवायरनमेंट एंड कैंसर. तो आज का जो टॉपिक है इसको हम इन मुद्दों पे डिस्कस करेंगे. कैंसर क्या है, इसके क्या कारण है, पर्यावरण और कैंसर का आपस में क्या रिलेशनशिप है, कैंसर के वार्निंग साइंस क्या हो सकते हैं, हम इसे किस तरह से अर्ली स्टेज पे डायग्नोज करके रिस्क रिड्यूस कर सकते हैं. ये सारी चीजें एनवायरनमेंट रिलेटेड ही डिस्कस करेंगे आज. तो कैंसर आपको क्या लगता है, ये है क्या? व्हाट इज कैंसर? व्हाट डज इट मीन टू यू रियली? So one thing is quite clear, when we hear the name, it really scares us. Whether you are in medical or non-medical profession, equally, it is a illness which causes some amount of uneasiness. It is not one disease, but it is a group of diseases. कई कैंसर, more than 100 cancers का समूह है, ये diseases का समूह है. एक बीमारी नहीं है ये, इस वजह से ये थोड़ा सा कॉम्प्लेक्स प्रॉब्लम है फॉर द पब्लिक हेल्थ पॉइंट ऑफ व्यू. सो इट इज अ ग्रुप ऑफ डिजीजेस एंड इट इज हैविंग many aspects to it which make it somewhat complex. So अगर हम साइंस की तरफ से जाए, if we look at scientifically, cancer is a disease where cells grow out of control. They invade, they erode and destroy normal tissues. So निरंतर बढ़ने का नाम ही कैंसर है और ये ना कि एक ही जगह सीमित रहता है लेकिन फैल सकता है और हमारे शरीर के जो नॉर्मल ऑर्गन्स हैं उनके अंदर भी घुस जाता है, उन पे भी प्रभाव डालता है. सो ये होता कैसे है? नॉर्मली हमारी बॉडी में सेल्स होते हैं, ये कोशिकाएं एक ऑर्डरली फैशन में नियंत्रित वे में ग्रो करते हैं, डेवलप करते हैं, मैच्योर करते हैं और अपना काम करते हैं. और जब उनका काम समाप्त हो जाता है, ये दे डाई, दी सेल्स फिनिश देयर जॉब एंड डाई. पर कैंसर में होता क्या है? दे आर क्वाइट डिफरेंट. दे जस्ट कीप ऑन डिवाइडिंग एंड दे डिवाइड विदाउट एनी ऑर्डर in a disorderly fashion, and they impinge on the food and the nutrition of the normal tissues. They invade them, they destroy them, and don't allow anybody to do their work. It's like a virus. It's a program that doesn't let your computer work at all. It's something to to that tune. तो malignant और cancerous tumor और benign tumor में क्या फर्क है? Firstly, as I told you, जो malignant tumor या cancerous tumor एक ही मतलब है दोनों का. They grow rapidly, they keep on dividing, they invade the normal tissues, and they can spread. They may spread through blood or through the lymphatic system. But unfortunately, these cells, even though their number is large, they do not differentiate, they do not mature, they don't do their job because they haven't learned how to do their job. But benign tumors, they're usually slow growing, they're usually sitting there, not growing in size, and they do not invade, they do not spread, and they don't bother the human body. They allow the body to do its own job. And basically, even if you let it sit over there, it is harmless. So we are talking about cancer and about the environment. In India, cancer is one of the leading causes of deaths. If you look at the top 5 causes of death in India, all cause deaths, then amongst the top 5, cancer comes number 5. And it is responsible for 8 to 9% of deaths from any cause. So as you can see here, heart disease are the number 1 killers, followed by infections, which could be diarrhea, respiratory or others. Then come the injuries, and then come all the cancers. You should also know that in India, nearly 18 lakh new cases of cancer are diagnosed each year. So it's a big problem. So cancer क्यों होता है, कैसे होता है? Quickly, we will go over that. It is believed, and different people have different estimates, that 70 to 90% of the cancers are caused due to certain environmental factors. And 5 to 10% do occur due to some genetic predisposition or some abnormality inherently present in the host gene. Of these various kinds of environmental insults which can cause cancer, diet, tobacco, infections, obesity, alcohol, poisons, chemical toxins, etc., are some of the ones implicated. In different parts of the world, the incidence is different, and we will deal with these as we go on in this lecture. So what do we really mean by environment? There are several factors, both inside and outside the body, which contribute to the development of cancer. And in this context, scientists refer to everything outside the body that interacts with human beings as environment. So, पर्यावरण क्या है? जो हमारे वैज्ञानिक हैं, वो ये मानते हैं कि कैंसर जो होता है, वो शरीर के अंदर कुछ फैक्टर्स होते हैं और बाहर कुछ होते हैं. जो फैक्टर्स शरीर के बाहर होते हैं, जिनके इंटरैक्शन से हमारे शरीर में कैंसर होता है, उनको वो एनवायरनमेंट के नाम से या पर्यावरण के नाम से जानते हैं. प्रदूषित पर्यावरण, ये भी मान सकते हो आप. सो इट इज एस्टिमेटेड, वहां मैंने देखा 90% कोई कहता है, 65-70% कोई कहता है. So these, about 2/3 of these cancers are clearly linked to certain environmental causes. And that really tells us that this is a big number. And this is a big number because it is important, because we can modify many of these factors and prevent the cancers. So what happens in this interaction of environmental factors and genes? So these environmental factors could be toxins, pesticides, viruses, radiation exposure, and many, many other chemicals to which we are exposed throughout our lives. So what happens? What happens is that our body every day is exposed to these chemicals. They are exposed to cosmic radiations, and they're also exposed to some modifiable factors like smoking, like vehicular pollution, like chewing tobacco, like having alcohol. All of these do produce some damage to our body. These damages occur in the cell at the level of the DNA. However, God has made such a fantastic human body that within it, there are repair mechanisms. Within the DNA, there are mechanisms of repair. So over time, we are able to correct most of these damages. But as we age, I want to just clarify, cancer is actually truly a disease of older age. When it occurs in younger persons, it is usually accidental or due to a genetic predisposition. So as we said, cancer is like heart disease. Cancer is also a disease of old age. And so over a period of time, due to the chronic exposure of these toxic chemicals or radiation or other factors, these errors in our genome, in our genes, in our DNA, they keep on accumulating. For many, many years, they have no effect on a person's health. But over time, some of these, they do cause mutations which our body is not able to correct. And those mutations actually cause the proliferation of cells leading to cancer. So what are the statistics? So just this was to give you an idea that what exactly role this environment plays, how the body reacts to it. So as we saw, we have a large number of new cancers occurring in our population each year, nearly 18 lakhs, maybe even more. The lifetime risk of cancer is 1 in 8 for men and 1 in 9 for females. The interesting thing is that many of these cancers, especially in our country, up to 70% can actually be prevented by modifying ourselves, our lifestyle, our environment, our habits, and our exposures. This is really critical. And therefore, we are talking about this very important thing called environmental cancer, because many of them we can improve and therefore reduce the risk of cancer. So if we look at these, the 3 or 4 major factors, number 1 is tobacco related, which could be smoking or smoke less tobacco, which means cigarette, bidi, but also betel nut, tobacco chewing, pan parag, pan, etc. Both of them have tobacco, and both of them are number 1 leading cause of preventable cancer in our population. Second are the diet, overweight, lack of physical activity. Another group, big group, it is the infections like hepatitis B, HIV, HPV. We will talk about these in some detail. This is just the first introductory slide for it. Then there is exposure to radiation, environmental pollutants, vehicular pollution, industrial pollution, chemicals like benzene, aflatoxin, many, many chemicals. You can make a whole book writing the name of list of all these chemicals. So I will start with the first and foremost preventable or modifiable risk factor for developing cancer in India. And if you see this data from ICMR and from the National Cancer Registry, you will see that tobacco is a major preventable cause of premature death and disease worldwide, and especially in India. About a third of the cancer's burden is related to tobacco-related cancers, and the economic cost of tobacco is almost 1% of GDP. So if you look at the smoking, tobacco is not just smoking. Then the main cancer is lung, but the smokeless tobacco, and I have specially shared these 2 images here to drive home the point that these kind of habits, they cause oral cancer, and which is seen very uniquely in our part of the world. It is not seen in the Western population because they don't have these habits. So अब आप ये देखिए कि केवल बीड़ी और सिगरेट से कैंसर नहीं, लेकिन पान पराग और तंबाकू खाने से भी कैंसर होता है. टोबैको रिलेटेड कैंसर जो होता है ऑलमोस्ट 15 डिफरेंट टाइप्स ऑफ कैंसर करता है. तो इंडिया में टोबैको कंजम्पशन का क्या स्टैटिस्टिक्स है? It is seen that 48% of males and 20% of females consume tobacco in our country. अगर हम स्मोकिंग देखते हैं तो स्मोकिंग मीन्स बीड़ी, सिगरेट एटसेट्रा, सिगार. 33% of males and 3% of females. So females में fortunately smoking कम है हमारे देश में. यूरोपियन कंट्रीज में काफी ज्यादा है. पर अगर हम स्मोक लेस टोबैको देखते हैं तो आप देखिए 33% इन मेल्स एंड 19% विमेन में भी काफी है. और स्मोकलेस है chewing erica nut, betel nut, pan with tobacco in it, pan parag which has tobacco in it. So these are habituating and these are carcinogenic. So if we habitually consume these, then we are risking our life and we are actually predisposing ourselves to cancer, especially of the oral region. Nearly 45%, these are statistics I have put just to drive home the fact that 45% of cancers in men and 17% in women are attributable to tobacco use. और अगर आप oral cancer देखेंगे, mouth, tongue, etc., तो 80% of these are attributable to tobacco use. So you can see that of the environmental factors, what a big component the tobacco related ones are forming, and we can modify these. What about alcohol? Definitely alcohol is less implicated in cancer as compared to tobacco. It actually causes more liver problems. 4% of cancers in India are attributable to alcohol, and they are also because of the damage to the liver, mouth, and the food pipe. So you can see the cancers which occur with alcohol are squamous cancer mouth, pharynx and larynx, इसका मतलब मुंह का कैंसर, और सांस के जो वॉइस बॉक्स है वहां का, फूड पाइप का, and many others are also implicated. अक्सर alcohol and smoking go hand in hand, so the risk is further increased. How common is alcohol consumption in India? So compared to the West, 30% of Indians consume alcohol, but the consumption of alcohol is the worst type in India. It is the pure alcohol spirits which are consumed. The wines have less alcohol in them and therefore less carcinogenic. So India has not such a high alcohol consumption compared to the West, but the type of alcohol we consume is more problematic. इससे ज़्यादा problem है. Especially ये जो हम country liquor लेते हैं, इनसे ये इनकी chronic use से कई सारे कैंसर होते हैं और liver failure भी होता है. So another preventable cause of environmental cause of cancer. Let us now move to infections. क्या infection से भी cancer हो सकता है? Definitely कुछ infections हैं, especially chronic viral infections. तो किस तरह के infections हैं? सबसे पहले we can take hepatitis B and C. So जो hepatitis B and C, chronic hepatitis B and C होते हैं, इनसे liver affect होता है और इनसे liver cancer होता है. But the most important thing to remember is कि hepatitis B जो है, उसके 34 million carriers हमारे देश में हैं, और hepatitis B हमारे देश के universal immunization program में बचाव vaccine भी है. So all our children should get hepatitis B vaccine during infancy, during early childhood, और ये कभी मिस नहीं होना चाहिए. 10 साल के बाद बूस्टर लगता है. तो आप ये देखिए हम किस तरह से ये हेपेटाइटिस बी रिलेटेड कैंसर को प्रिवेंट कर सकते हैं काफी आसानी से, और हमारे देश ने ये हमारे यूनिवर्सल इम्यूनाइजेशन प्रोग्राम में बनाया भी हुआ है. Then we have the HIV, human papilloma virus infection, and then many other infections. So how do these infections spread? So one is we can protect ourselves from some of these infections like hepatitis B and hepatitis and human papilloma virus by the use of bachao ke teeke, through the use of vaccines. But how do they actually spread from one person to the other? So some of these are sexually transmitted, and another set of these, so we can do safe sex, use of condoms to protect ourselves. The others like the hepatitis B, C and HIV, they spread through contaminated blood, blood products, reused needles, syringes, sharing of needles, especially in the drug addicts. Also when people are buying not properly accredited consumable products and reusing consumable needles and syringes. And the various cancers which can be occurring due to these viral infections include stomach cancer, cervical cancer with HPV virus, and hepatocellular liver cancers. And the most important is we can prevent most of these through bachao ke teeke se, through vaccines and through our behavior modification. Another big preventable cause of cancer. Moving on to obesity, diet and physical activity. So एक सवाल है, क्या इंडिया में मोटापा प्रॉब्लम है? बिल्कुल है. More than 65 million Indians are obese. Do you know that? We have a large population, so we have a large number of obese people. As per the National Family Health Survey, if you just look at, we are not looking at children, but we look at just men and women, then about 15 to 20% of our adults are either obese or overweight. There are 6 cancers which occur, और ये आप देखिए, junk food, ये packet foods, ये aerated drinks, जो टीवी में इतनी तरह से एडवर्टाइजमेंट में हमेशा रहते हैं. These are big responsible factors for our obesity. 6, undernutrition is there in our country, but a huge amount of overnutrition and obesity is also there, and we have a large population. So with so many people being obese and overweight, we have to really study, does obesity occur? So young adults, young people, in them the obesity is rising. Actually, it is an epidemic in the Asian and in the developing countries now. And some of the important cancers which occur due to these factors include colorectal cancer, breast cancer, kidney and liver cancer, pancreatic cancer, uterine cancer, etc. So definitely clear indication is there, and this is a modifiable risk factor. Then there are many environmental toxins which can lead to cancer. So some of these we can reduce by reducing our carbon footprints. So vehicle pollution, industrial pollution, and in this we always say, if you don't need to use a vehicle, you can either walk, use the stairs, or you can use a cycle. That is much better. Same way the industrial pollution. If we are just allowing the effluent to drain into the river, then we should know that all the water that comes to a house is actually coming from there, even though it is treated for sewage. But there are many industrial toxins which are being thrown into the river without any thought about what it is going to do to those who will consume the water. The whole world is one ecosystem, and we need each of us to be responsible for preserving our ecology. Then there are many pesticides. There are many chemicals like benzene, which have been implicated in cancer. Although we don't understand exact dose, but we clearly know that these chemicals, they cause cancer. Then poisonous mushrooms and aflatoxins are very well known to cause liver cancer. Then there are certain exposures like drugs used for cancer, chemotherapy and radiation, which also cause, but we also have to understand that we always weigh the risk versus the benefit. If a person has a cancer of which he is going to die and the death chance is 80 to 90%, but the drug that we use can cause cancer in say 2 or 5 or 10%, then definitely we will choose the one where the chance of cancer or the chance of mortality is less. So we always weigh the risk versus benefit. But we should know that even radiation exposure, which may be cosmic radiation, it may be due to a radiation emitting plant, it may be from certain industrial usage. All of these do cause. We know atom bomb really caused exposure to thousands and thousands of people in Japan who are still laboring under the effect of second malignancies after radiation. Also, those who have very light skin, excessive sunlight exposure, excessive UV light exposure causes skin cancer. Fortunately, in countries like India, where we have good melanin in our skin, this is definitely less. So after reading all of these things, what is the good news? The good news is that a large number of cancers in our country are preventable, almost 1/3. And the top 3, if we say preventable cancers, are cervical cancer, breast cancer, and oral and lip cancers, right? And 1/3 of these we know can be caused by tobacco-related products. And a good 15, 20, 30% can also be due to the obesity, physical inactivity. So to understand once and to reinforce that many of these are in our own control, that we can modify our own lifestyle to reduce the risk of cancer in our older age. So how do we go about this? In the cervical cancer, the pap smear, visual inspection, staining with acetic acid, and the HPV testing. These are clearly in studies, in randomized studies, have clearly shown that they reduce the risk of cancer amongst the women 30 to 50 years of age, 30 to 49 years of age. And this test does not mean a very hi-fi anything. It has to be done by a trained healthcare worker who could be a nurse, who could be a doctor, who could be a trained healthcare worker. And clearly, even one round of screening can reduce the risk. 3 to 4 rounds of screening can reduce the risk tremendously more. Also, the mortality after one round of HPV testing, that means we test for the human papilloma virus in the cervical smear, and even that, just one round of testing, and then intervention in case they are positive will also help reduce the risk. And vaccination with the vaccine in the early teenagers before they become sexually active goes a long way in reducing the risk of cervical cancer, which is an important and number one cause of cancer in our rural women. So this is very, very important, not very costly, and very effective. Same way the oral cancer. People who have got high risk behavior, that means they consume tobacco products, they should get their mouth. First is prevention, please modify your behavior. Even if you stop using it, it is good that you get your mouth checked once every few years, especially if you have a non-healing ulcer or a white plaque inside your mouth. The third is the breast cancer screening. In this, we have to have a measure of what kind of intervention we will do. So by clinical examination, in women 40 to 50 years of age, one can easily screen. What we call is breast self-examination or examination of breast by a trained healthcare worker can also be done. So screening women once at the age of 35 or 30 to 40 years is believed to reduce the lifetime risk of breast cancer by a significant amount. And why is it only once? It is once because it increases the awareness, and the people themselves can do a self-examination at home on a regular basis. And the awareness also is that if you diagnose a disease very early, then the chances of cure are very much more than if the same disease is very advanced or very widespread. When a disease is very advanced, then the cost of treatment and the chance of cure is also much different. So what I was just saying, why do we need to screen? Why do we need to diagnose these early? One is it increases awareness that cancers can occur to anybody, and it often comes unannounced. Second is when we screen, we can find precancerous lesions. And if we do find precancerous lesions, we can warn the person that you are at risk. Please get frequent monitoring and frequent checkups so that we can pick it up early. When picked up early, treatment is usually mild, less costly, and the results are excellent. Then we also need to know that there are not all cancers are fatal. There are many cancers with proper treatment, the persons can be completely cured for life, of which the most important being the childhood cancers. And for childhood cancers, I would also like to emphasize that environmental causes have not been implicated for childhood cancers. These cancers are supposed to be mutational accidents. So like I showed you, 5-10% cancers, there is no environmental cause. So most of the childhood cancers come in that group. Then there are a number of cancers like germ cell tumors of ovary, of testes, of mediastinum. Germ cell tumor also occurred in Yuvraj of the mediastinum, and he is cured. As you know, he's playing cricket. Then there are lymphomas, early breast cancer, early cervical cancer, oral cancers. All the early cancers which are picked up in the first or second stage are curable with little treatment, little surgical or little treatment. So what then are the warning signs of cancer? So once we know the screening, once we know that we can modify behavior, we should also be aware that there are certain warning signs. So when we talk about warning signs, it means that when should I consult the doctor? What happens if I have some change in suddenly diarrhea and constipation is alternating for last few months and I cannot explain it. Or I have a sore. The sore should have gotten well in a week or 10 days, but actually it's there for 6 weeks. I should show the doctor. Or there is unusual bleeding, especially per vaginal. If there is a thickening or lump in the breast, I should show the doctor, I should consult. It may not be cancer, but it may well be. And if it is, perhaps it is early cancer. Same way, difficulty in digesting or difficulty in swallowing. Obvious change in a wart or a mole. So if you have a mole and suddenly bleeds, suddenly grows in size, you should consult your doctor. Or there is a nagging cough or hoarseness. This symptom, especially in that scenario when the person is either a smoker or exposed to a lot of air pollution. Childhood cancers also have certain warning signs, and the type of cancers are somewhat different. And again, some of these symptoms may be seen, which are unexplained fever, headache with vomiting or persistent bone pains, a mass anywhere in the body, presence of bleeding, pallor or tiredness, which is again for 4 to 6 weeks, and white reflex in the eye. So these are some signs which are slightly different from the adult cancers. And I want to highlight that every year we do activities for awareness and for celebrating our survivors. And this is one such program in which we did what we call celebrating life of our cancer survivors. And this is simply to highlight cancer is curable. And after the cure, especially if it is diagnosed on time and treated properly, these people can go on and get integrated in society and lead normal lives. So to summarize, environment plays a major factor in the causation of cancer. And if we group them, then there are certain lifestyle factors, which are tobacco use, nutrition, physical activity. There are exposures occurring to naturally occurring things like infections, UV light, radon gas. Then there are exposures related to medical treatments. There are workplace and household exposures. There is pollution, which could be vehicular as well. But many of these we can prevent. That means we have the power in our own will to change our lifestyle and modify many of these exposures and also take protective action like taking the proper vaccine at the right time. So the prevention, therefore, as I have tried to show here, is eating a healthy diet, regularly exercising, limiting alcohol use, maintaining a healthy weight, minimizing your exposure to radiation and toxic chemicals by taking protective precautions, avoiding smoking or chewing tobacco, and reducing sun exposure, especially if your skin burns easily. So as you know, science and technology have revolutionized our lives. We have cars, we have aeroplanes, but we also have memory, tradition, and myths. Many of the myths related to cancer are false, but we need to use science, we need to use our knowledge to modify our exposures and reduce our health, our risk, and have healthy lives. With this, I conclude my talk, and I emphasize that Rajiv Gandhi Cancer Institute and Research Center is committed not only to treat you with cancer when you come to us, but also to increase the awareness, to help prevent cancer and to reduce your risk by doing these awareness lecture series for the public at large. Thank you very much. And if you have any questions, please put them in the chat box so that we can have a lively discussion. Thank you.
Thank you, ma'am. This was a very wonderful and बहुत ही आसान और सरल शब्दों में बहुत ही स्पष्ट तरीके से आपने इस कठिन टॉपिक को सबके सामने रखा, and hopefully participants को काफी कुछ इससे लाभ भी हुआ होगा, and there are some questions actually which I got through. Some I have answered already. So one was like, if the family has a history of lung cancer, uh, what are the steps to detect and prevent it in next generation? So I think I've already answered it online. So usually lung cancer as such is not hereditary, but there is some increased risk of developing lung cancer if there is a family history. And but we don't have to do any extra additional test or some there's nothing extra we have to do as per the standard guideline. If the person is of the age of 50 to 80 years and there is a history of smoking for past 15 years, so ideally if somebody comes into this particular zone, then he should get a low dose CT scan once a year, even if no one in your family has a lung cancer. If if these individuals are considered high risk. Ma'am, there was one question which is being asked, like, is leukemia is genetic or not? So I
Right.
thought you will be better person to answer this.
So the first thing I'll just want to add about the smoking, the lung cancer.
Yeah.
As Dr. Kundan, you have rightly said that smoking increases the risk of cancer. And if this cancer occurred in a smoker, and even if the other family members are non-smokers, then we have this second-hand and third-hand exposure to smoking. So the sofa may have, those tobacco toxins, the chemicals from tobacco burn sitting on the sofa. So if a child is playing on the sofa and touches the sofa and touches the mouth, they will ingest. So smokers, children also are at high risk for getting lung cancer or getting tobacco related cancers. Also passive smoking, the wife, if she's in the same room, the children are in the same room. So in that way, lung cancer due to smoking may be higher in the families if this smoking behavior is not abandoned. About leukemia and the genetics of leukemia. So there are two types of leukemia, acute and chronic leukemia. Most leukemia, about I will say 5 to less than 10% of leukemia are hereditary. So genetic or hereditary leukemias are rare. They occur in less than 10%, maybe about 5 to 10%. But leukemia can also occur with exposure to toxins, toxins like benzene. So if you are living in an industrial belt and your water source is affected, then many people in the village or in the family may get affected. But as I said in one of my slides, that there is an interaction between the chemical agent and the genes. If your genes have got a robust repair system, you can be protected. Otherwise, you will be susceptible. So usually leukemia is not inherited.
Yeah, ma'am. I think leukemia, ma'am, थोड़ा सा आप explain भी कर दो. I think बहुत सारे लोगों को they must be not be understanding what exactly we are talking about.
तो ब्लड कैंसर जो है, ALL, AML दो प्रकार के होते हैं. आमतौर पे ये जेनेटिक नहीं होता है. आमतौर पे एनवायरनमेंट से होता भी है कि नहीं ये भी क्लियर नहीं है. पर जो सॉलिड कैंसर होते हैं, आपने देखा होगा मेरी लिस्ट में कोई भी एनवायरमेंटल फैक्टर ल्यूकीमिया में कम होता है, पर कुछ केमिकल्स हैं जैसे कि बेंजीन है, पेस्टिसाइड्स हैं जिससे हो सकता है, पर आमतौर पे जेनेटिक नहीं होता है, परिवारों में नहीं जाता है. करीब करीब 5% से 10% के ब्लड कैंसर परिवारों में हो सकते हैं जेनेटिक के लिए, पर 90% नहीं होते हैं.
Well said, ma'am. Actually, there is one more question with regard to, I think this is specifically for the breast cancer, risk of breast cancer in next generation if mother has faced it. So,
तो एक मैं बताऊंगी, बाकी आप भी बताइएगा थोड़ा सा. तो एक चीज होता है लीफ रोमेनी सिंड्रोम, कुछ जीन म्यूटेशंस होती हैं. तो उन जीन म्यूटेशंस में फैमिली में ब्रेस्ट कैंसर का रिस्क ज्यादा होता है, और ये यूजुअली यंगर एज में होता है, 40-45 ईयर्स से कम में. इनमें मेटर्नल साइड में ब्रेस्ट कैंसर का रिस्क ज्यादा होता है. और आप, आई थिंक डॉक्टर कुंदन, आप कुछ ब्रेस्ट कैंसर के वो ब्राका वगैरह का बताएंगे.
Ma'am, actually, what this is Shivani Malhotra. What she is asking is if her mother is having a breast cancer, so what are the risks of getting breast cancer for her actually. So is there any increased risk? I think the breast cancer is something where there is a strong, it is very strongly associated with a family history. And if there is one first degree relative which is affected by breast cancer, then your risk of developing cancer doubles. And if there are two first degree relatives, then it is 5 times higher risk of developing breast cancer. So definitely one should actually get screened.
Screening.
Screening is very important, and specifically if the history is like if your mother had a breast cancer at an early age, and accordingly more early you have to go for a screening. So that is something we should be very careful about these things. And side effects of, there is one more question, side effects of regular PET CT of CA breast. So side effects, what they want to know is
So most important, आवाज आ रही है? Can you hear me?
actually, is there any harm of getting PET CT?
तो डेफिनेटली जो ब्रेस्ट का टिश्यू है वो रेडिएशन को सेंसिटिव होता है, तो इसीलिए स्पेशली यंगर एज में तो हम लोग यूजुअली अल्ट्रासाउंड से ही काम चलाते हैं, एंड वी डू इट ओनली इफ इट इज एसेंशियल. आई थिंक एग्जैक्ट नंबर्स पेट स्कैन के हम अननेसेसरली बार बार पेट स्कैन नहीं करते हैं, किसी भी पेशेंट में हो, चाहे ब्रेस्ट का हो चाहे कुछ भी हो. तो जब हमें लगता है कि पेट के बगैर काम नहीं चलेगा तभी हम करते हैं. किसी भी एक्सरे से, किसी भी सीटी से, किसी भी पेट से रेडिएशन एक्सपोजर होता है. तो these tests are to be done only if medically indicated, not just to see के देख लेते हैं क्या हो रहा है. अक्सर लोग आजकल ये पेट इतना सेक्सी हो गया है कि हर एक आदमी चाहता है कि एक होल बॉडी पेट स्कैन कर लेते हैं. तो this is to be discouraged.
Yeah, it's sort of a fashion kind of a thing कि oncology में है तो पेट करना है तो पेट करना है. The point here is very important, is risk versus benefit. You see, whenever we weigh if doing a PET scan is going to change the outcome of the treatment and we are going to change something, and if it is like there's a particular stage in all the cancers where the PET is warranted, not everywhere once you are diagnosed with cancer तो PET होना ही होना is not that way. So I think अगर risk हमारा because of PET scan की वजह से जो exposure है radiation का उसका risk ज़्यादा है versus the benefit which we are going to achieve, then definitely we avoid doing a PET scan. But हाँ, जहाँ पे हमें लगता है कि the kind of benefit which we are going to have by doing a PET scan, हमारा पूरा management change हो जाएगा, there the whole scenario, the whole timeline, the way we are going to treat the tumor is going to change, then definitely we should do a PET scan. And there are some very personal, pertinent management questions. I think we will avoid that because there is some question like somebody was diagnosed with this thing and how to go about it. So I think
right. मतलब पैपिलरी कार्सिनोमा है, किडनी कैंसर है, जो भी कैंसर एक बार हो गया है, then you must follow your oncology doctor's monitoring schedule. जिस तरह से वो आपको कहते हैं कि आपको 6 महीने में या साल में स्कैन्स करने हैं या चेकअप के लिए आना है, आप प्लीज करिए. अगर आप कहते हैं कि इनमें हेरिडिटरी का क्या रिस्क है, तो जैसे मैंने बताया, मोस्ट कैंसर्स में हेरिडिटरी का रिस्क 5 से 10% से कम ही होता है, उससे ज्यादा नहीं है. पर एक बार कैंसर किसी को हो जाता है तो आप प्लीज मॉनिटर करिए. और ब्रेस्ट कैंसर अगर होता है तो जरूर से फैमिली हिस्ट्री इंपॉर्टेंट है, और उसके लिए आपको अपना चेकअप रेगुलरली कराना चाहिए, चाहे ब्रेस्ट सेल्फ एग्जामिनेशन हो, अगर लंप आता है तो अल्ट्रासाउंड कराइए, स्पेशली अगर आपकी उम्र कम है. और अगर आप ऑन्कोलॉजी डॉक्टर को कंसल्ट करते हैं, वो कहते हैं कि आप मैमोग्राम कराइए तो कराइए. अपने आप से टेस्ट ना करें, डॉक्टर की एडवाइस के हिसाब से.
Yeah, there's one interesting question here or a suggestion. This is from Dikti Diwan. I think she's asking, she's a cancer survivor and she had an endometrium cancer. I want to know about the diet. Is it okay to have milk? This is a very common question. Milk products or non-veg. As we know from alternative medicine that these products make body acidic and should avoid consume same. So basically the diet, the role of diet in patients
so role of diet
have already cancer. Yeah, ma'am. Yeah, please.
रोल ऑफ डाइट में कई चीजें मिथ्स में चली जाती हैं और कई चीजें हैं जहां पे साइंस ने आपको डेटा दिया है. देयर आर ट्रायल्स विच हैव प्रूवन थिंग्स. तो कुछ चीजें, एक ये जो आपने एल्कली डाइट, मीट डाइट ये पूछा, और जो डॉक्टर की हैसियत से मैं कहूंगी प्लीज हैव हेल्दी बैलेंस्ड फूड, प्लीज हैव इनफ seasonal vegetables and fresh fruits in your diet. Please try to avoid junk food and food that is having preservative in it. The preservative food, the junk food, they are known to predispose you to obesity, and that is likely to lead to cancer. Alkali, ये भी देखा गया है कोलोरेक्टल कैंसर उन पॉपुलेशंस में ज्यादा होता है जो ज्यादा रेड मीट खाते हैं, जो मीट खाते हैं, वेजिटेबल्स कम खाते हैं. पर अगर आप मेरे को पूछो कि नॉनवेज से किडनी कैंसर होगा, नॉनवेज से थायराइड कैंसर होगा, नॉनवेज से कुछ होगा, इसका कोई डेटा नहीं है. नोबडी नोज द आंसर, बट पीपल डू नो दैट इफ वी हैव healthy balanced diet with a good proportion of seasonal vegetables and fresh fruits, it is healthier. And please do physical exercise about 30-40 minutes at least 5 days in a week. Try to take the stairs and walk wherever possible. Please try to reduce your carbon footprints. These things we know from science. आप जो पूछ रहे हैं वो अभी मे बी आप फ्यूचर में उसका एक रिसर्च कर सकते हैं.
बट ऐसा कोई डायरेक्ट एविडेंस नहीं है मैम कि इन चीजों को हमें लेना चाहिए या नहीं लेना
डेटा
चाहिए.
नहीं है,
लेने से कोई प्रॉब्लम
डेटा नहीं.
या एंड व्हाट्सएप के मैसेजेस में भी काफी इस तरह के मैसेजेस आते हैं कि शुगर आप अवॉइड कर दो, शुगर ट्यूमर को फीड कर रहा है, आपका ट्यूमर बढ़ने लगेगा, एकदम से भागेगा. इफ यू आर अ कैंसर पेशेंट यू शुड नॉट गिव शुगर, बिल्कुल शुगर कट कर दो. सो उसका कोई डायरेक्ट एविडेंस नहीं है. देयर इज नथिंग. वी नो दैट ट्यूमर सेल्स दे कंज्यूम शुगर, बट इसका ये मतलब नहीं है कि अगर आप शुगर लेते हो तो ट्यूमर सेल्स ज्यादा तेजी से ग्रो करेंगे. बट द पॉइंट हियर इज कि इसका, जैसे मैम ने बताया, कि देयर आर सम इनडायरेक्ट इम्प्लीकेशंस. इफ यू आर taking a sugary food या junk foods ले रहे हैं तो obesity होगी, and that indirectly actually predisposes to a risk of certain cancers. I think we
have another 5 to 7 minutes.
5 minutes. Ma'am, एक what I would like to आंसर, मतलब टू आस्क यू अ क्वेश्चन रिगार्डिंग, ये भी बहुत कॉमन क्वेश्चन है जो लोग पूछते हैं, इज कैंसर कॉन्टेजियस? सो दिस इज
इट्स अ मिथ.
वेरी कॉमन क्वेश्चंस व्हिच कम्स इनटू प्ले. तो
कैंसर इज नॉट कंटेजियस. इट डज नॉट स्प्रेड बाय सिटिंग टुगेदर और ईटिंग टुगेदर. और अगर कैंसर पेशेंट का खून भी आपको लग गया तो आपको कैंसर नहीं होगा. कैंसर नॉन कम्युनिकेबल डिजीज है, और अंदरूनी आपका कैंसर प्रिवेंशन का जो क्या बोलते हैं इम्यून सर्वेलेंस जो है वो काम नहीं कर रहा, इसलिए आपको कैंसर हुआ है या किसी को भी हुआ है. इट इज नॉन इन्फेक्शियस, इट्स अ मिथ.
मैम सेम लाइन पे ऐसे हम लोग से भी यही बहुत ज्यादा मतलब कॉमन क्वेश्चन पूछा जाता है कि अगर रेडिएशन ले रहे हैं तो क्या हम कैन बी फीड आवर बेबी, या कोई हमसे मिल सकता है आके घर पे. सो अगेन आई वांट टू क्लैरिफाई दैट पार्ट आल्सो, बिकॉज देयर आर डिफरेंट काइंड ऑफ रेडिएशंस. लाइक if you have undergone a PET CT scan there where the dye is being injected, so for some time there will be some radiation. So for that particular period, probably a day or two, you have to avoid meeting people. But if you are taking radiation as a treatment, external radiation, so usually आपकी body में कोई radiation नहीं जाता, तो you are not like a contagious kind of a thing. You are not dangerous for others. So everybody can meet you and can have lunch or dinner with you. So no issues with that. एक और मैम बहुत कॉमन, आई थिंक यहाँ क्वेश्चंस में, मैमोग्राम आर नॉट बीइंग यूज्ड फॉर डिटेक्शन इन फ्यू कंट्रीज टुडे. योर व्यू प्लीज.
सो आई थिंक हाई रिस्क पॉपुलेशन में मैमोग्राम इंपॉर्टेंट है. हर एक को मैमोग्राम नहीं करना है. अलग अलग कंट्रीज में कट ऑफ्स भी अलग डिफाइंड है. मैमोग्राम का कॉस्ट भी है और रेडिएशन एक्सपोजर भी है. तो उस वे में अलग अलग देशों में अलग अलग कट ऑफ्स हैं. जिस पॉपुलेशन में रिस्क ज्यादा है, जैसे फैमिली हिस्ट्री है, तो उसमें इंडिकेटेड होगा मे बी आफ्टर द एज ऑफ 50 और 45. एंड देन एज पर योर डॉक्टर्स, हमारी कंट्री में कोई पॉलिसी नहीं है, लेकिन यूरोप में, यूएसए में, अलग अलग देशों में है. पर मैं आपको इसलिए नंबर नहीं बता रही हूँ क्योंकि आप सोचोगे हमें भी वही करना चाहिए जो अमेरिका में हो रहा है, लेकिन ऐसा नहीं है. तो यंगर एज में हम लोग क्लिनिकल एग्जामिनेशन करते हैं और हम लोग अल्ट्रासाउंड करते हैं अगर हमें लगे कुछ है. आपको पता होना चाहिए मैमोग्राफ से भी ब्रेस्ट टिश्यू, स्पेशली यंग पीपल के ब्रेस्ट टिश्यू में रेडिएशन एक्सपोजर होता है, तो वो अवॉइडेबल है. तो इसीलिए नहीं करते. एक और सवाल था योगा और प्राणायाम का, ये बहुत अच्छे हैं, दीज आर टू बी एनकरेज्ड। ये हमारी लाइफ में स्ट्रेस कम करते हैं। आपको पता है आज की लाइफ में इतनी फास्ट हो गई है कि रिलैक्स करने का टाइम नहीं मिलता है। तो अगर आप प्राणायाम करते हैं, योगा करते हैं, मेडिटेशन करते हैं, बहुत अच्छा करते हैं, करिए और अपने आस पड़ोस सबसे करवाइए, अपने परिवार में सबसे करवाइए। इट्स अ गुड थिंग।
And the only caution here is do yoga and pranayam, but जो alternative medicines associated with it have that
You
उसका
should avoid.
direct
Yes.
evidence नहीं है कि they help in cancer prevention as well as in cancer treatment. So specifically अगर आपका cancer treatment चल रहा है तो बिना अपने डॉक्टर को बताए हुए कभी भी किसी भी तरह का कोई भी alternative medicine नहीं लेनी चाहिए. That is very, it can be very harmful for you also. मैम एक और उसके जस्ट नीचे आपकी स्लाइड्स के ऊपर ही किसी ने क्वेश्चन किया हुआ, इन वन ऑफ द स्लाइड्स of reason of causing cancer drug, I knew it that this is going to come. So drug chemotherapy was mentioned, how and why, as chemo is considered treatment for cancer.
So so देखिए, we have to be transparent. We must say that there are some things which can cause cancer in certain doses, and we have to see what Dr. Kundan very rightly said, risk क्या है और benefit क्या है। कोई भी चीज हम करते हैं तो उसमें कितने फायदे की उम्मीद है और कितना उसमें खतरा है, ये दोनों चीजें देखनी है। अगर हम ईविंग सार्कोमा का इलाज नहीं करते हैं तो ईविंग सार्कोमा पोटेंशियली फेटल डिजीज है, वो कुछ महीनों में या सालों में जानलेवा बन जाती है। आज के दिन में जो भी ट्रीटमेंट है उसमें कीमोथेरेपी, सर्जरी और रेडियोथेरेपी है। ये ट्रीटमेंट भी शरीर को कुछ ना कुछ इंजरी तो करते हैं, लेकिन हर इंजरी को रिस्क से हमें और बेनिफिट से हमें तोलना है। जैसे कि मान लो किसी की टांग में ट्यूमर है और आपको टांग निकालनी है, लेकिन टांग निकालने के बाद जान बच सकती है, तो ये आपको डिसाइड करना है कि क्या मुझे जान चाहिए या नहीं। सेम वे रेडिएशन का भी है और कीमोथेरेपी का भी है। इनसे रिस्क रहता है, पर अगर रिस्क है से 5% 20 साल में और जो बेनिफिट है वो है 70%, तो आप क्या चूज करना चाहेंगे, ये आपको देखना है। तो डेफिनेटली हर चीज हम करते हैं अपने कॉन्शियस विल से करते हैं, नॉलेज और सब कुछ जानते हुए करते हैं। कैंसर मुश्किल बीमारी है, जानलेवा है। अगर अर्ली स्टेज में डायग्नोज होता है तो ये सारे ट्रीटमेंट बहुत ही कम इस्तेमाल होते हैं, सेफर रहते हैं।
Thank you, ma'am. I think we have 3 minutes here, last 3 minutes. So again, there's one question regarding alkaline water, or there's some Shannon water. People are trying many things. So is alkaline water is curable or controllable for on cancer? Somebody has asked this. So I think our answer would be same. I think these are alternative medicines, and I don't think there is any evidence. किसी भी तरह का हमारे पास कोई भी ऐसा स्कोप है जहाँ पे कि हम ये कह पाए कि ये आप इलाज करेंगे तो इससे कैंसर में फायदा होगा। So I think ma'am also would agree with the same point.
I agree. Maybe some of you are young people who have taken science. Maybe you will become scientists and you will study what is the benefit, and you will enlighten us and the community at large about the real benefit. अभी तो ये सारे मतलब without data चल रहा है, तो scientific नहीं है।
As a scientist, actually, we never say that it is not beneficial. We say we don't have any evidence that we can suggest that you take this treatment, because हमारे पास कोई ऐसा evidence ही नहीं है. We have no scientific evidence. So we have to generate evidence, and then probably if there is some evidence, then definitely one would go for that treatment. But till this date, particular date, we don't have any evidence to suggest any sort of treatment on the basis of this. I think we have all.
I think we got one more question. Immunotherapy. I think we can touch on immunotherapy and targeted therapy. तो एक बहुत अच्छा सवाल आया था कि क्या कैंसर के ट्रीटमेंट से कैंसर हो सकता है, क्या कीमोथेरेपी से कैंसर हो सकता है। तो आज के दिन में हम लोग मॉलिक्यूलर लेवल में, जेनेटिक लेवल पे बहुत सारे टेस्ट कर रहे हैं। हमारे हॉस्पिटल में भी जो हमारा रिसर्च और डायग्नोस्टिक लैब है, वहां भी हम ये स्टडी कर रहे हैं। तो दिन ब दिन कुछ नए टारगेट्स हमें मिल रहे हैं जिसके लिए गोलियों से ट्रीटमेंट हो सकता है, जिससे हो सकता है फ्यूचर में कीमोथेरेपी का रोल कम हो जाएगा और खाली एडवांस डिजीज में होगा। तो ये इम्यूनोथेरेपी, ये टारगेटेड ड्रग्स, ये अगर और आविष्कार से और नए ड्रग्स आ जाए तो हो सकता है जो लैंडस्केप कैंसर ट्रीटमेंट का है वो सेफर हो जाएगा, मोर इंडिविजुअलाइज्ड हो जाएगा. इसको हम कहते हैं प्रिसिशन मेडिसिन. So let us hope that some of you will be scientists who will explore these avenues and bring us safer treatments for cancer. Till then, this is what is the standard treatment.
Yeah, ma'am. And I think, as you have rightly said, now only हमारे जैसे lung cancer was a disease which was where the metastatic lung cancer stage 4. हम कभी सोचते भी नहीं थे कि पेशेंट 2 साल, 3 साल, 4 साल निकाल पाएंगे. तो now it is more so ever with this immunotherapies and targeted therapies. These diseases are also becoming like a chronic disease. Like that, we can't cure diabetes, but it will always be there. Same way, probably if we cannot cure cancer, probably we can make it a chronic disease at some point of time. I think we have finished the timeline. So lastly, ma'am, I would like to just conclude, just give a nutshell of what we have discussed so far in few words, and then I will conclude this talk.
So my last word is, in India, cancer is preventable in a very large percentage, but these are possible mainly by modifying our lifestyle and our habits. So it is in our hands to make this change. So go ahead and empower yourself to make your lifestyle risk safe. God bless you. Take care.
Thank you, ma'am. And I would like to announce that the next lecture is on 30th August 2021. And lot many questions which came up here will be answered in that session also, like infection causing cancer. The topic is infection causing cancer, nipping the evil in the bud. The speaker would be Dr. Seema Gulia from TMH Mumbai, and this session will be moderated by Dr. Mansi Sharma. I would like to conclude here. Sir, Dr. Anurag Mehta, sir, would you like to, sir, conclude here?
So I will just want to thank everybody. I mean, the participants, because they have patiently listened and asked very interesting questions. They have really made it a very interactive session. And I will hope and pray that they continue to provide their support and attendance and participation in the future lecture series. And these small little efforts on our part actually can help reduce the incidence of cancer in our communities and the burden of cancer treatment and all the other associated problems associated with cancer in the families. So thank you so much for attending. And thank you, Dr. Gauri, for a very lucid presentation, and Dr. Shoffel for excellent moderation. So thank you all, and we look forward to seeing you again on 30th. Thank you, and take care.
Thank you, sir. Thank you.